My name is Bryan Sloss. I am a psychotherapist practicing out of Ontario. I'm also a psychedelic-assisted therapist, which is why I guess I'm here speaking about it, given my background on psychedelics and its usefulness in the treatment of many, many issues that present themselves in my practice. My own experience with psychedelics is quite historical. I remember the days when it was very, very illegal and still gets occasionally categorized with some much more destructive substances. I'm very happy now that it's more available to those people who do need it. Early in my career, I remember working with a number of individuals who were struggling with addictions, and a psychedelic approach would have been fantastic. Unfortunately, it was not available to them at the time, so it's great to see the differences that have come up over the past few years. Yeah, psychedelics have always been present in my life. Growing up in Northern Ontario was always something that was available, but you never were quite sure as to where it came from. And the concerns, of course, was what you were using or taking. So again, it's the control of the substance where it's more readily available and put out in the form that's safer and understood is a great change to what we've seen in the past. A lot of times in psychotherapy, you hope for the very best with the techniques you use. But on occasion, you come up to certain circumstances or experiences or tendencies that fall short due to a protector or a concept or a fear or an inability of how to actually access it. With a psychedelic treatment, a lot of those protectors or defenders are gone. You're able to explore different pathways, different thought processes where you're there to receive information or have an experience, and then later on with the integration, work those into your life with a new understanding of what's happening and a greater perspective, which provides you with the tools to move forward with whatever is the presenting issue. So again, when it comes to psychotherapy, it's not one singular aspect of the human existence. It's not just an emotional issue, it's not just a physical issue, not just a spiritual issue. It's a combination of everything. So being able to see someone and have the ability to access and understand all the aspects that make us up as human beings makes me a better practitioner. I get to provide more, I get to experience more, I get to explore more with the individual. And when things are described to me, being the curious passenger, I want to be able to understand the journey and what it is they're seeing and experiencing. If a question is asked and something we're exploring, I love to be able to tap into all the aspects that the human experience provides. If someone does show up asking for anything psychedelic assisted, ketamine therapy being the number one option right now, we explore the why behind that. What it is they're assuming is going to happen, what's their understanding of it. So a lot of it's psychoeducational to begin with, and then we do the exploration as to what they were hoping to have happen. You can get a good idea of where a person's headed with psychotherapy in general within 1 or 2 sessions, depending on how much closure there is there, how much risk and danger they're feeling with any kind of description of what's happening. With a few thorough discussions and challenging people on what's happening, you can get to a point where you kind of understand what a ketamine-assisted therapy would do for them. The key difference between a psycholytic and psychedelic, as opposed to dose, is how deep of the dive it is. My role still stays the same. My role is to not interfere with the process. I'm quite often writing down questions I'll ask in the integration as opposed to the moment, because the moment is for the medicine. And so it's again my role. It's how quiet am I being based on the experience. A psycholytic, I'm there, I'm guiding, I'm asking the kind of questions I would, maybe not as intently as I would with a regular psychotherapy appointment. With a psychedelic, I'm there as the compassionate observer. I'm watching what's happening, I'm there for whatever does present itself, but the true integration happens later in time, maybe a couple of days after. The actual session itself is, again, a lot of notes, a lot of questions. What did you see? What did you experience? How was it? Was it a positive? Was it a negative? Starting with the general concepts of what the experience was. And it may be something just purely emotional based where it felt good. It was euphoria, I found it fantastic. Or I was crying inside the whole time and I was very sad about something and a lot of imagery came up. I saw colors. And then we try to figure out where that goes into the intention as you went in and how it plays into your actions and behavior going forward. Different toolkit. There was a lot of fear. There was a lot of a presumption that this is how my life's going to be. I'm permanently a substance abuser, and I'm going to do my best to get from point A to point B, and then point B to point C. If I use, okay, but I'm starting over again. So ketamine-assisted therapy would allow you to access different things. It gives you a rewiring of your concept of yourself, a strength. So the resistance, the urge is what drives them for the use, the addiction portion of it. The addiction portion of it is always tied into a number of thoughts where I'm going to use, how long can I hold off? So the approach we take in therapy, again, ketamine-assisted, is I don't have to be a user. I don't have to be a drug user. I don't have to relapse. Instead, I've rewired my entire concept of myself and my approach going forward where I have the strength not to use. And these are the reasons why. The thing that keeps people from coming to psychotherapy in general also keeps them from pursuing any kind of psycholytic-assisted therapy. It's the unknown. It's terrifying. Who's this guy I'm sitting in front of and spilling my life out to? What kind of response am I going to get? I'm going to tell them some things that I don't quite like talking about. And how's that going to feel when the conversation comes out? It's terrifying because you're revealing your true heart. Psycholytics help you do exactly that as well. It's your true heart. So that's why the whole concept of trust and connection and that resonance occurs beforehand in psychotherapy and with psychedelic-assisted therapy, where you have that connection and the freedom to do so is there. So you allow that exhale and you kind of can relax into the process, and then everything flows.